Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Charlie Cloninger. He's a kidney transplant recipient, and Nauman Shahid. He's a nephrologist. Together, they wrote the Kevin MD article, How Early Care Saved My Life from Silent Kidney Disease. Charlie and Nauman, welcome to the show.
Thank you. Good.
Thank you, Kevin.
All right. So, Charlie, you shared your story on Kevin MD. So, for those who didn't get a chance to read it, just tell us a little bit about yourself and the story that you shared on Kevin MD.
Well, I'm Charlie Cloninger. I'm 77 years old. At 74, my doctor found some strange things going on with my blood and urine test. And so he referred me to Dr. Shahid to take a look, see what was going on with my kidneys. And I went in to see Dr. Shahid. They evaluated me. Dr. Shahid came to me with a plan, said, you do have kidney disease. Right now, you're in the treatment stage. You're not in the transplant stage, and you're in the kidney treatment stage. And so he had a plan to keep me off of dialysis and carry me to a transplant. And he put that plan into effect, and here I am today, happy, smiling, and ready to go.
And Charlie, did you feel anything before you proceeded on that journey? You mentioned you had some urine tests that showed some abnormalities there, but what exactly were you feeling around that time?
Well, actually, I wasn't feeling anything that I didn't blame on old age. I was just, losing the energy, a little bit of memory loss, just, the little mild odds and ends. But I just kept saying, well, hell, Charlie, you're getting old.
And as far as you know, did you have any kidney issues before this journey?
I did not, but my mother actually died from kidney failure, kidney disease, and you know, I followed her through that and helped her with it, but didn't pay attention to what she was going through and didn't realize that this was something that I could inherit and carry on and have.
All right. Norman, you're Charlie's nephrologist. So tell us how Charlie presented to you when you first met him.
Yeah, I remember 3 and 4 years ago, Charlie. He came to our office, a story much like any other patient who comes to our office and really does not know much about what's going on. And I can remember him being surprised, being concerned, and being uncertain about future after our conversation. So I remember that first and probably second meeting for him rather distressful with a lot of information, a lot of uncertainty. And as Charlie said, he really didn't have any symptoms out of normal that he could sort of put his fingers on, which is very common for almost all of our patients that come and see us. And interestingly, this is one of the bigger challenges that we in nephrology community face, and also our colleagues in the primary physician, that patients are completely asymptomatic, even till very advanced stages of kidney disease. And helping them understand that that's what's going on, it's really very difficult for them to comprehend it because they're just feeling fine.
So, Nauman, when Charlie presented to you without a lot of symptoms, tell us the type of questions that he asked you and a little bit about that diagnostic journey that the test that you recommended and the path that it took to come to a diagnosis.
So the very first meeting, I and most of colleagues generally spend time helping patient understand what they have. And that's why this first meeting is so very important. Because if you are unable to help your patient understand what's going on, what's the nature of their kidney disease, where everything is going to lead to, you are going to lose a partner in the care. So the very first meeting, we generally try to keep it very focused. We don't talk a lot about specifics. We talk about general things. What are your kidneys? What are kidney functions? What is your kidney function? What is your risk of getting worse and what we're going to do? So after that initial conversation with Charlie, I told him, Charlie, we got to do three things for you. The first is try to stabilize and stretch your kidney function for as long as we can. Number two, by using that time, Let's help you get a kidney transplant even before you ever need dialysis. Number three, because most of our patients like Charlie not only suffer from kidney disease, but the complications associated like heart disease and diabetes and vascular disease. So while we are trying to do number one and number two, let's try to save your health from these complications like a heart attack and stroke. I said, Charlie, these are the three things. Bring your family next time. Let me know what other information you need. Let's meet again in a few months and then talk about the specifics of each one of those.
So, Charlie, as you met Dr. Shahid for the first time and had subsequent interactions with the healthcare team, tell us what was going through your mind as they were telling you about your kidney disease and all the implications from that. What were you thinking? What was going through your mind?
Well, of course, I was thinking back about my mother and how she died from kidney disease. I was thinking about also how she absolutely refused any dialysis and why. Why did she refuse dialysis? And then Dr. Shahid had said, we're going to try to keep you off of dialysis. And so, just trying to do what I could do to get the results that Dr. Shahid was looking for. That was the main thing on my mind.
And Charlie, just in general, tell us about the interactions that you had with Dr. Shahid and the other members of the healthcare team. What about those interactions was most important to you as a patient?
Well, actually, the very first thing was my confidence level.
Hmm.
Dr. Shahid and his assistant, very confident. So my confidence level went up. Actually, believe it or not, one of the first things they treated was my depression. Before they even treated, it seemed like before they even treated my kidneys, they treated my depression and that I had received. But just the fact that I appreciated him so much, the plan. He had a plan and he worked and he was going to work the plan and I appreciated that.
And Nama, when Charlie asked you these questions here, just tell us in terms of next steps. He mentioned that he wanted to stay off of dialysis. So tell us that decision point that you as a nephrologist kind of confront that patient with, that fork in the road of dialysis or not. What are some of the questions that you asked yourself to guide the patient along the right path?
That's a very important question. I'm glad you asked. One of the biggest thing that we have to sort of help guide which direction we're going to go is how far advanced the kidney disease is. And that's where an early referral to a kidney specialist is so very important. And I'm glad in Charlie's case, when he came to saw us, he did have moderate to advanced kidney disease, but we felt that there's enough opportunity there to intensely focus on helping him staying healthy and get him a kidney transplant. Unfortunately, that's not the routine. We still see a lot of patients who come to us very far advanced in this stage of their kidney disease. And for us, unfortunately, the first thing we have to do is talk and prepare them for dialysis and then talking about transplant. For all of nephrologists, our wish is to be able to see patients relatively early in the stage of their kidney disease, much like Charlie, and where we have an opportunity to do things that can potentially change the outcomes, which is avoiding dialysis for their lifetime or getting them on a transplant.
And Nauman, what was the ultimate kidney diagnosis that necessitated the transplant? And just talk in general about clinical outcomes.
Right. So the kidney disease is complex. It's chronic, which means that it's years and years of damage, something that has been going on for a very long time. Type 2 diabetes, type 1 diabetes, high blood pressure, obesity, family history. These are all common risk factors for kidney disease. And for patients who have some or all of these risk factors, the chances and risk of kidney disease go up. So having these patients come in with these risk factors to their primary care physician, getting screened for kidney disease with their simple basic test and referred to a nephrologist on a timely fashion is the key for the management here. And once in a nephrology office, traditionally, nephrologists have been really just given an opportunity at the later stage to help prepare them for dialysis. But I think with more understanding and realization that how important the early referrals are, we feel there's an opportunity for us to really improve the outcome of our patients.
Charlie, when you first heard that you needed a kidney transplant, what was your reaction?
Actually, it was relief because I knew I had been riding the borderline and didn't qualify. And so when I actually heard that I qualified, it was a mental relief to know that something was really getting ready to happen. And that's when Interwell Health got involved. I met Miss Kathy. Now, Miss Kathy took me to a whole different level. She was the lady that took me out. She introduced me to the kidney surgeons. She introduced me to the social workers. She let me talk with the insurance people. She showed me dialysis. She took me a tour and showed me what dialysis was if I had to go that far. And she prepped me for the transplant. And that's when I really felt good and excited because something was going to happen.
And Charlie, again, how important was that coordination of care? Because I think that it's not just one doctor, right? You have a whole healthcare team behind you. And it sounds like in this case, this team was well integrated from the nephrologist, like Dr. Shahid, to the surgeon who did the operation. So it sounded like there was a unified team behind you. And how important was that for you?
It's amazing. I mean, it's just totally amazing. I brag about my transplant team. I love them, and I love the way that system works. But Kathy was my director, and Interwell Health directed me through it, and and introduced me to these people and moved me where I needed to be when I needed to be there. In fact, she's here today, and I just felt so calm when I called them. They gave me an answer, and that's all I needed. My confidence level was so great.
And Charlie, how's your health today?
My health today is fantastic. I'm back to shag dancing and DJing and I didn't coach football this year, but I've been coaching youth football up till this year, but I took this year off because I don't have quite have the endurance that I want yet. I'm working on building back my endurance, but my health and feeling good, I'm feeling great.
So, Nauman, it sounds like in this case, early detection really led to a really great outcome for Charlie. So, I'm a primary care physician. I do internal medicine. You said that screening, looking out for early symptoms are things that we in primary care should do. So, specifically, what kind of tests, what kind of things should we be doing in the primary care setting that would potentially point to early kidney disease?
I think in our modern day evaluation, we're fortunate that measuring the kidney function and measuring the signs of damage to the kidney in urine, such as protein leak in the urine, can be done fairly quickly and inexpensively. So I think identifying the high-risk patient population, which we just talked about, and making sure that those patients get their risk factors managed, at the same time, getting stratification for the risk of kidney disease by these tests is really valuable. The other thing I'll mention is that you said a magic word, which is coordination, which is the backbone of success to help patients with complex medical problems, particularly the kidney disease patients like Charlie. It starts with an early detection, an education, and third final piece is coordination when they land in our office. Makes perfect sense, sounds great, but unfortunately, it's something that has not been done very successfully in our healthcare system. And the reason being that the backbone of our healthcare system, the most prevalent form is still fee for service, where margins are very narrow. It's a volume driven initiative, does not leave physician and practices with enough resources to focus on all these three things. And that's where the transition away from fee for service to the value based care to be able to help practices generate some additional resources that can be utilized to provide education and care coordination is so very important.
We're talking to Charlie Cloninger and Nauman Shahid. Charlie is a kidney transplant recipient. Nauman is a nephrologist. And we're talking about the Kevin MD article, How Early Care Saved My Life from Silent Kidney Disease. Now, I'm going to end by asking each of you just to share some take-home messages with the Kevin MD audience. Nauman, why don't you go first?
But I would say to my primary care physicians and colleagues, as just talked about, thank you for screening your patients. Thank you for looking for kidney disease and early signs, and we're grateful for your timely referrals. I think this is a key in our ability to help our patients do well. My second message is to my patients and their families, much like Charlie. I know it is scary. I know there's uncertainty, but education and knowledge is your friend. So when you are in your physician's office, and look for opportunities for education. If they schedule you for an education visit, this is a very important. Go ahead and do that. And my third message is to my colleagues in nephrology. All of us have been talking about for years that whatever we are doing does not seem to be enough. Our patients are just not doing well. I think there's an opportunity for us to change the paradigm, move away from fee-for-service to value-based care, and sort of use these additional opportunities of care coordination, providing more resources to our patients, and help our patients, their families, and communities in general.
And Charlie, we'll end with you. Just share your take-home messages with the audience.
Well, don't be afraid to talk to your doctors. Don't be afraid to talk to your nurses and your PAs. If you've got something bothering you, talk about it, because not knowing doesn't mean you don't have. A lot of people think that, well, if he don't say I got it, I ain't got it. But the truth is, kidney disease is there. If you're having problems, any kind of problems, don't blame it on old age. Find out what it is. Get the knowledge.
Well, thank you everyone for sharing your story time and insight. Thanks again for coming on the show.